Now it's time for tonight's orthopaedic question time. Please welcome your host, Mr. Jonathan Dimbleby.
Dr. Cassie Thomas, Dr. Thomas.
When should a child that presents a sporting injury be referred?
Quite a difficult question to answer in this particular position. I think you need to break down the patients into two groups, really. I think you need to break them down into acute and chronic. I think acute is pretty easy, really. If you've got, obviously you have to take the history and examine them. If there's a history of trauma and there are physical signs of a fracture or significant loss of function, be that the upper limb or the lower limb, then they need to be sent in for an acute assessment. I think the chronic ones are more difficult, really, and your decision to refer on is influenced really by two factors. Firstly, you haven't got a clue what's going on, and that does happen. Or secondly, you're put under a lot of pressure by the parents, which happens an awful lot. Perhaps one other thing that if we take something fairly simple like Osgood-Schlatter's disease, and I'm sure you all know what Osgood-Schlatter's disease is, a traction apophysitis of the...
Should we just ask anyone who doesn't know to put up their hand? Okay, those who don't know but don't want to admit it in public, would you put up your hands? Yeah.
I think with that sort of situation, I think I would manage it conservatively for 2 or 3 months. And if the child was getting better, then I'd pat them on the head and say, don't worry, everything's going to be all right. Keep taking the tablets, limited use of sport. But if they're not making any significant improvement, then I think that's the group that you need to send on.